Good afternoon. I am Beverly Francis Gibson, CEO of Together Women Rise. And today I'm excited to meet Asia Blackwell, joining us from Guatemala to share more about Maya Midwifery International. Asia?
Good morning, Beverly. So nice to be here. Thank you for the platform.
Wonderful. So I understand that you have a short presentation for us. I'm going to go ahead and let you share that, and then we'll come back and I'll ask you a few questions.
Perfect. So thank you once again for allowing us to come and share this platform with you all at Together Women Rise. Once again, my name is Asia Fresse Blackwell. I'm the Executive Director of Maya Midwifery International, and I'm really excited to dive into some of our programming and explain a little bit more about our organization. So Maya Midwifery International is a 501c3 registered in the state of Massachusetts with a mission to improve maternal child health outcomes by helping to prepare and sustain local midwives in their communities and helping them to have a voice in local and national policies which affect them. Our project is located in the Republic of Guatemala, which is located in Central America, in the Department of Quetzaltenango and in the municipality of Concepcion Chiquirichapa, though we are starting to expand throughout the area MUM, or the MUM area in this region. The communities served by our projects consist of about 50,000 people, about 80% of whom are Indigenous Maya, pertaining to the ethnic group MUM. This area suffered significantly during the 36-year Guatemalan Civil War, which is now deemed a genocide of the Maya population, which ended in 1996, so a very recent history. Our work in this area is made possible through our collaboration with our implementation partner, ACAM, which is the Association of Midwives from the MUM area, with whom our relationship goes back approximately 23 years.
Wow.
But just to provide a very brief history, the first meeting was held in 1999, which began fundraising in the United States, which allowed us in 2021 to buy a plot of land in the area. And in 2003, we started construction of the birth center, which was inaugurated in 2004. And for this 20+ year history, MMI has been providing capacity building opportunities to the midwives of ACAM, acting as a fiscal sponsor and administrative support. So let's look a little bit closer at the ACAM Birth Center, which is the only medical facility in Guatemala owned and operated by Indigenous midwives. You can see their logo as well. It is currently staffed by 14 Indigenous midwives, 12 of whom are independent and fully trained, and 2 are still in the training process. We also collaborate with a general physician who provides general consults in the birth center. Decision-making is made by an internal board of directors composed of 7 Indigenous midwives, and actually in March, we'll be holding our general elections to kind of revamp the board and get some new faces involved. So the birth center offers a unique model of care that balances ancestral knowledge with global evidence-based midwifery care. We provide prenatal, birth, postpartum care and family planning, as well as cervical cancer screenings, ultrasound, and general consults. In 2022, approximately 3,000 prenatal consults were provided at the birth center itself, and 365 births were attended. Over our 23+ year history, there have been 0 maternal mortalities, and this year we've had 0 infant mortalities, and approximately 100 referrals to upper level services have been made.
Wow.
Now to jump over more and focus a little bit specifically about our project with Together Women Rise. Our title of the project is Improving Access to Reproductive Maternal and Newborn Care in Rural Guatemala, which very much focuses on mobile operations. So first is our mobile clinics, with the objective of providing regular local access to critical health services in 4 hard-to-reach communities. And this is done by deploying 1 mobile clinic in each community per month and reaching an average of 100 clients per month across the 4 communities. So we are currently in the communities of La Nueva, Las Victorias, Tulcanava, and Las Barrancas. This access is provided generally due to impassable roads. We have a 4x4 vehicle that allows us to reach there. The high cost of transport and general family and home life demands that keep the women within their own communities. We are able to collaborate with local Indigenous leadership who provide us the space to hold these mobile clinics and set up our operations. And they also announce and encourage their community members to attend the mobile clinics. We're also supported by the Ministry of Health, which we're very happy about, to also advertise the clinic, specifically our use of ultrasound and allowing people access to this technology. Consults at the mobile clinic are offered for around 5 quetzales, which is less than $1. However, these fees are always waived if necessary. In 2022, these mobile clinics allowed us to reach and provide access to over 1,000 more consults. And as we move forward, and in the last year, we've been working incredibly hard to improve our data collection over these programs. Our second objective is to improve clinical education and training opportunities for midwives and other health workers by providing mobile trainings to community midwives and clinicians. So we work with a larger group of 71 midwives, and we provide them with birth kits, and they receive monthly trainings from the ACA midwives, providing culturally competent education in MUM. Generally, this covers the utilization of their equipment that they've received in their birth kits or birth management, and helps us provide sustainable care within the communities themselves. And these midwives also bring their clients to our mobile clinics to receive additional care from ACAM. And finally, our third objective refers to our referral systems. And we're hoping to improve referral and transportation linkages between communities and higher level facilities, which include the ACAM Birth Center itself and the National Hospital in Quetzaltenango. And this is for complicated pregnancies, deliveries, and newborn care, and whatever emergency might arise. So once again, we're working with local leadership to develop emergency plans, modes of transport, which are both public and private, a phone tree, and many other different implementations to ensure successful linkages to higher level services. Here you can see the hospital in Sheila, which is 25 minutes away.
Oh,
However,
wow.
from mobile clinic communities, it's much further distance. So in conclusion, this unique model of care improves health outcomes for women and their families through the provision of high quality, cost-effective, culturally appropriate, and locally accessible care. And we are so incredibly appreciative of your support with Together Women Rise. Thank you so much, Chonte, which is thank you in MUM.
Lovely. Thank you so much, Asia. You did a really good job of comprehensively explaining the services that you've provided, as well as the projects that we're funding. Can you tell us a story about someone from the organization who's benefited from your services?
Yes, absolutely. So the benefit from our organization is twofold. We have the benefit from the midwives themselves and also from the women who are receiving the care provided. So in terms of our midwives, we started this organization, as I mentioned, in 1999, with midwives who were starting to organize in their communities and had the traditional knowledge of care. I'm very happy to say that today, more than 50% of the midwives that work at the birth center are certified. Well, of course, they have their ancestral knowledge, but now they're also certified in suture, in IV placement, in ultrasound technology, as well as managing hemorrhage within the birth center and the application of medications. So as I mentioned in my presentation, we have not seen a single maternal mortality within the birth center in over 20 years.
That is amazing, amazing.
Yes, it's an incredible feat in Guatemala, as we do have one of the highest maternal mortality rates in the region.
Yeah. I think that is really commendable, and kudos to you and the team for all of this hard work over a 23-year history, right? It is amazing to see that. And I love the mobile clinic because, again, it makes it easier to alleviate some of those obstacles for the women if the clinics are mobile and are coming to them. Share with us what has been the reaction from the wider community. I was very intrigued to hear that the health department, the Minister of Health, is also supporting you. Are you getting support from any other groups, or and the leaders of the villages are also supportive, right?
Yes, absolutely. So we work in coordination with the Ministry of Health. And as the years have progressed, we've been receiving more recognition. We're also working with local Indigenous leadership, which is considered to be a kokole. Of course, we're always within the local leadership meetings to ensure that our presence is welcomed and wanted, and to encourage safe care. The midwives within Guatemala have such a unique position within Indigenous communities in that they are considered leaders themselves.
Yeah.
Right.
Yeah.
So even though we're perhaps talking about a machista context, as women, they are still community leaders. We also work in coordination as such with the women's sector in Guatemala. And we're excited that we're continuing with our radio programs. So we're in communication and coordination with local radio stations to provide reproductive health information in mom more accessibly.
Nice. I love the fact that you're doing this in a broad-based way, and we know that marketing using the radio stations and ways to communicate with women is also key. What's the youngest age that someone could be trained as a midwife?
That's a great question. So it depends. Of course, we always want to encourage furthering education if that is possible. And we actually are incorporating a scholarship program that does assist our midwives with continuing education, right? So we don't want to train or favor midwifery training over school education. Yes. However, currently, our youngest midwife just turned 16. She's a midwife in training. And when we heard that she wasn't continuing her education, we provided her with a scholarship, and she is studying now on the weekends to finish her high school education.
Wonderful, wonderful. And I think it's a great training ground, right, for young women who may not see that the traditional school is something that they want to do. But I think the fact that you're still encouraging her to finish school and do this, I think is amazing. Do you see that this is also a way for the women to earn a living beyond the training that they receive?
Absolutely. So right now in Guatemala, there has been some political movement to try to recognize the work of the midwives. As we hear from many of them, it's a calling that each one of them possesses, a don, which is how it's referred to in Spanish. So they're not doing this work for an economic reimbursement. They're doing it to serve the women within their communities. Okay. However, of course, they all have their own families, yes. Right? And we should recognize the work that they're doing. So the government has implemented an annual salary provided to the midwives who possess their carnets or their certifications. Nice. Unfortunately, the one payment they receive annually is less than the minimum wage for a month. At ACAM, it's our goal, and we've been successful in accomplishing this, to provide over the minimum wage for each of these women who work with us.
Great, great. Because we definitely want to make sure that they're self-sufficient at some point. So it's good to hear that you're moving in that direction, and can really help them think beyond just where they are today, but the future, and the future of their families. As we know, if a woman is bringing in income and is supporting herself, then ultimately the family benefits.
Right. And it helps with preservation of the profession in general, because what we're seeing is many young women, even if they feel that spiritual calling, are not pursuing it because they don't think they can make enough to sustain their family.
Yeah, that makes a lot of sense. Can you share with us some of your future plans? What's next?
Absolutely. So we're excited. 2023, we have a lot of big things coming. As we move forward with our mobile clinics, as I mentioned, we're expanding into some different areas that are all parts of that mom area. Mm-hmm. We're also implementing our student immersion program, where we're welcoming anyone who's interested, birth workers or anyone with an interest in maternal and child health, to come and learn from the midwives at the birth center. We're hoping this will really help with sustainability of the birth center in general.
Yeah.
And we're really excited to also be collaborating with some different organizations in Guatemala who are also training midwives to introduce them to the birth center and open up the possibilities for midwives across Guatemala.
Oh,
Right. Our
yeah.
main goal moving into the future is to be able to replicate this model and to provide this opportunity to all of the midwives who are open to it.
Yeah, I love that very much. Replication is really, really key. And just hearing the success that you've had in terms of your infant mortality rates over time, I think that is something that definitely we want to replicate and have other places think about incorporating as they look at how can we do what we do better. And I like the fact that the women are called to this, and it's a passion as well, because then you know that they're in it for the long haul.
Absolutely.
I love that. I really, really love that. I also wanted to just say that the work that you do is so important to the lives of not just the infants and the moms, but definitely I saw lots of dads in the center, hugging their babies, looking at their babies. So what generally has been the reaction of the dads?
Right. So as I mentioned, the midwives have a very unique position in society to be thought of as leaders and to be
Yes.
looked to for the knowledge that they possess, both from the women who are birthing and also the husbands.
Yes.
Another interesting role in Guatemala is the role of the mother-in-law, so the husband's mother.
Oh,
So as I mentioned, it's a machista society, which oftentimes husbands and mother-in-laws are the ones making decisions for the birthing patient. But within this unique position and the sense of trust that the midwife has, she's able to communicate with them both, get them more involved, educate them to help the woman, come to these decisions that really should be hers to make.
wow, wow. Yeah, it's just interesting to hear about the cultural impact that the mother-in-law has and the influence that she has as well. But I just want to just say that we need more programs like this, obviously, around the world, here in the United States. And I just want to take the time on behalf of Together Women Rise to commend you and to say that we're very excited to partner with your organization and look forward to hearing more about your successes as well as the lessons learned. What are the things that you and your team learn over time that help you improve and also address some other issues that may arise that are not visible at the moment. But just thank you for the opportunity to have Together Women Rise be a partner in your success and in your growth. But Asia, thank you so much for joining me today. I'm sure our members will be excited to learn more about your important work and obviously may have additional questions as they learn more about the organization and the work that you're doing with the midwives. Please thank them on my behalf for everything they're doing to impact the lives of women and families in Guatemala and beyond. So thank you so much for your time today.
Thank you so much for having me. It's an absolute pleasure to be here, and we're very, very appreciative of the partnership as well.
Likewise.